This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Hope your week is off to a fine start. Coming up this morning, we'll be discussing low-cost walk-in labs with Mon Health, and we've got a couple of guests on the phone this morning. We have Misha Tate, Director of Laboratory Services, Mon Health Medical Center. Good morning, Misha.
Good morning.
And we have Dr. Krystal Atkinson, Chief Nursing Executive for Mon Health System. Good morning, Dr. Atkinson.
Good morning.
Well, guys, thanks for taking a few minutes with us here on a Monday morning. We'll get into the focus of our discussion in just a moment. But first, we love to put our guests on the spot, get to know them just a little bit better. And Misha, because your name's first on the list today, we'll start with you. Tell us about yourself, where you're from, your training, and how you ended up with Mon Health.
Hi, I'm originally from Kaiser, West Virginia, over in the Eastern Panhandle. I came to Morgantown to attend WVU, and I graduated from there with a Bachelor of Science in Medical Technology. I started at Mon after graduation, and the reason I chose Mon was because of the community feeling. When I came in for my interview, everyone was so welcoming. The employees had been there long term, which shows a lot for the facility.
Yeah, you came to WVU, you come to Morgantown, and it gets that grip on you, Misha. You just
it really did.
You find a place, you find a home, and you stick around. So how many years you been with Mon Health now?
I've been there for almost 19 years.
Wow. You know, we hear this week in, week out when we get to talk to whether it's physicians or nurses or others on the staff. Doesn't seem to be a whole lot of turnover. When people find a place there, they stick around, and we hear a lot of those 19, 20-year stories here on the program.
That's true.
All right, Dr. Atkinson, let me see. How did you end up with Mon Health?
So, Kyle, I'm actually a native of Richmond, Virginia, and as I've been told, I have made my way to the best Virginia, but I have been most of my career in Virginia. I spent some time in New Hampshire and was just looking for something a bit closer to home, and this opportunity presented itself. As Misha stated, and it truly is true, I came in and just really fell in love with the people here. My husband and I love it here, so I couldn't imagine being anywhere else, honestly.
How did you get into medicine to start with?
You know, I had just some great mentoring from one of my aunts. She's a nurse, and I just watched her over her career, and I love her dearly and really wanted to emulate her, and that was really my opening.
We hear a lot of that, too, also, where you get some inspiration from someone in the family. So, we're happy to have both of you on the show today. So let's jump into the topic. Mon Health System now offering affordable walk-in lab testing for patients at Mon Health Medical Center. We'll start with Dr. Atkinson. Why is this important, and why is it important to the patient?
Yeah, I'll let Misha certainly go into a lot of the detail, but, you know, Kyle, we've talked over the past year and just really looking at the opportunity to be able to have our patients, one, have testing when they're starting to feel that something's not quite right. We've seen where patients have just waited and waited and waited, and then they get to a condition where they definitely have to have hospitalization. But when our physicians start to work with them and just looking that when we start to work with them, we could have done some things preventatively if we had that opportunity to see them earlier. And really that's one of the focuses that we really want to try to impress upon people, that let's start to see, get some testing, and it certainly starts from a lab perspective, and start to have those diagnoses and treatment plans earlier in the game.
All right, Misha, what kind of tests are we talking about here for these walk-in lab testing?
We currently offer a comprehensive metabolic panel, which would include your electrolytes, your white blood cell. We also offer a CBC that does your white blood cells, hemoglobin, hematocrit, You could get a lipid panel for cholesterol, PSA for men, TSH for thyroid, hemoglobin A1C to monitor your blood sugar over time. Also, some of the vitamins, vitamin D, B12, and folate.
So are these when patients say, I'm going to get my labs done today, or I've got to go get my labs done? Generally speaking, this is what we're talking about?
This is some of the most common tests. Yes, that would be.
What are some of the conditions or some of the, I don't know if ailments is the right word, but what are some of the issues that could be detected through these labs that you could catch early on and would be able to treat?
You could definitely catch diabetes early on if the blood sugar is increased. Some of these tests for kidney function, your hemoglobin, if your hemoglobin is low. You can detect iron deficiency, liver problems.
There's a whole host of issues that you can catch. And Dr. Atkinson, I don't know how many times we've spoken to physicians, again, nurses, staff on this program, who always tell me the same thing. If we catch something early, if we detect it early, it's much more treatable. It's much easier on the patient rather than if we catch something down the road, and that speaks to the importance of these labs.
Absolutely, definitely. And I think, our physician colleagues, once they have that ability to be able to get these tests in hand, they can sit down with the patient, and then it's a different conversation versus something that we're really going to be a bit more aggressive with. So this is certainly a wonderful thing for our community.
Can you also kind of head off a condition? Maybe numbers are high in this area or they're low in another area, and you can make adjustments to your lifestyle, your diet, or your exercise, whatever the case may be, to fend off something that, hey, if this continues in this, you may develop X. I know I'm speaking generally here, but I would assume that's also possible, again, when you get these kind of tests done.
Right, and I think that, as Misha just stated, I think the one thing that, and there are many, but the one thing that comes to mind is you'll hear the term prediabetes. And so, as Misha is talking about that elevated A1C, that elevated blood sugar, having the information before the physicians to be able to say, okay, well, if we do this and we make some modifications to lifestyle, we may be able to keep you off medication. We may be able to further keep you off something, people do not want to hear about having to use insulin for the rest of their life.
Sure.
So there's certainly some things like that. Diabetes is just one example.
And Misha, will I need a referral from my physician, or is this something I could walk in and say, hey, I think I need to get these lab tests done?
You can just walk in, and there will be a form at the front desk, and you just pick which test you want. That you do not need a physician order. At Mon Health Medical Center, the provider will be able to see the results, but you will not need an order from the provider.
We're talking about low-cost walk-in labs this morning. Our guests are Misha Tate, Director of Laboratory Services at Mon Health Medical Center, and Dr. Krystal Atkinson, Chief Nursing Executive for Mon Health System. We've got to squeeze in a break. We'll continue our conversation in just a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Misha Tate, Director of Laboratory Services, Mon Health Medical Center, and Dr. Krystal Atkinson, Chief Nursing Executive of the Mon Health System. We're talking about low-cost walk-in labs that are available at Mon Health. Misha, you mentioned this right before the break, but can you explain how patients go about getting their results once they've had these tests done?
Yes, the patients could go to the Mon Health portal, and to sign up for that patient portal, all they would have to do is go to monhealth.com.
All right, and Dr. Atkinson, let's say I just walk in. This wasn't something my physician said that I needed to go get done. It was something I thought, okay, I've never had this done, or it's been a while. I go in, I get these labs done, I log in, I get my results. What do I do with those at that point?
So at that point, you have the ability to be able to have those conversations with your physician, and that's a great opportunity to be able to set up some regular visits. We all should have an annual checkup. There's certain things as we get a little bit older, we need to be able to have closer attention paid to. So this is another, this is an opportunity to be able to look at those things before they get out of whack, and allows us to be able to make those subtle changes. So we do not have to utilize medications or have any other type of interventions. That's a little bit more serious.
Yeah, I'd say I could go get the labs, I could get the results, and I got to be honest, Dr. Atkinson, I probably wouldn't have a clue what all of those numbers mean, or if they're good, bad, or ugly. So I would definitely probably have to bring them to you or somebody, and have them take a look at them for me. I'm sure a lot of people are like that.
As Misha was sharing, that once those results are available on the portal, from our website, if you don't have a physician, it's very easy. If you go to monhealth.com, there's a link that says Find a Physician, and we have phenomenal primary care physicians right in the area. Very convenient to be able to have same-day visits.
And I think this would be a question for you, Misha. Do I need to have some sort of health insurance coverage to get these? Can I pay for these out of pocket? Are there any barriers there?
No, these will be paid out of pocket. We don't accept insurance for these. Payment will be accepted right at the registration desk. Well,
and I started with the show with this, but I want to reiterate it again. Why is it so important to offer the low-cost walk-in labs, especially here in West Virginia?
This allows the individuals the ability to gather the information they think is relevant from these tests and present it directly to their provider. I think it gives them convenience. They don't have to wait for a physician order, carry anything in with them. The screenings can ease a patient's mind, or it can direct them to their next medical decision.
And I would think if you're someone, again, who's, you got to make every dollar count, you hear the words lab test, you probably think it's very expensive. And I would imagine there is a misconception that these are too expensive and it's something that you just can't get done. What I'm hearing today is that's quite the contrary.
Yes, for these direct labs, that we've made them comparable to our community health fair prices. You can come in and get like a vitamin B12 level for $10, or a complete CBC count for $20.
Talking to Misha Tate, Director of Laboratory Services, Mon Health Medical Center, Dr. Krystal Atkinson, Chief Nursing Executive of Mon Health System. Dr. Atkinson, and this may be a bit of a loaded question, but are enough people getting their labs done, or more often than not, are you seeing that folks that's something they ignore or maybe put off, or just think, well, I'm only this, I'm only 31, I'm only in my early 40s, I don't need to get those things done yet. Do you hear that a lot?
Kyle, all of the above. And, I think just for the reasons that Misha just stated, when we think about, $10, $20 to be able to ascertain whether or not we're on the right path with our health, certainly that should not be a barrier. And that's certainly the reason for making sure that those prices are comparable to anything that we've done in the past, or, across the state from a community fair standpoint. That's really the goal. We really want to make sure that those barriers are removed from people thinking that, I don't have time, you can walk in. I don't have the resources. It's certainly very affordable. We've got to make sure that we're making our health a priority, and this is one additional step to move in that direction.
Hey, Misha, can you just walk me through the process? I come in, I fill out the forms, I get my name called, I go back. Can you just walk me through what, getting these labs done, what that process actually is for the patient?
Yes, you would undergo phlebotomy procedures, so the patient will be called back. They'll draw just a couple of tubes of blood from your arm, and they'll let you go on your way, and then you should receive the results through the Mon Health portal. So
the whole process, less than an hour?
Less than 10 minutes.
Less than 10 minutes. Oh, well, you could get that done.
As long as there's no other patients waiting. If you have to wait a little bit.
We mentioned it's walk-in. Can I schedule an appointment, or is it walk-in only?
It is walk-in only.
All right. It sounds like, quite frankly, about as convenient as it could be made possible for the patient. We'll continue our conversation, and we'll wrap things up with Misha Tate, Director of Laboratory Services, Mon Health Medical Center, and Dr. Krystal Atkinson, Chief Nursing Executive for Mon Health System when we come back on Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got about 2 minutes left here with Misha Tate, Director of Laboratory Services, Mon Health Medical Center, Dr. Krystal Atkinson, Chief Nursing Executive for Mon Health Medical System. Where and when, Misha, can patients go to receive their affordable lab testing?
Friday from 8 to 5 at either the outpatient lab in the main lobby of the hospital or on the fourth floor of Building 2000 at our medical park.
That's Monday through Friday, 8 a.m. to 5 p.m. And Dr. Atkinson, where can folks always find more information?
If they visit monhealth.com, we have the information for physician services, for laboratory, anything that you want to find connected to our hospital and our system.
Misha, I'll give you the last word here this morning. What do you want listeners to take away from our conversation today?
I'd just like listeners to know that they have the opportunity to come in to get their labs done at their convenience, and that we would like them to take control over their health.
You know, it's probably not the greatest comparison, but it's one that works for my brain. I take my truck in to get regular maintenance done, get tested, head off problems before they start so it continues to run properly. Our bodies work much the same way. Take them in, get them tested. You head off problems before they start. I know it's probably a bad comparison, guys, but it's one that works for my brain.
It works well.
Yes, it does.
Good.
Misha Tate, Director of Laboratory Services, Mon Health Medical Center, Dr. Krystal Atkinson, Chief Nursing Executive of Mon Health System. Guys, thanks for taking some time with us on a Monday morning. Have a great day, and we'll talk again soon.
Thank you.
Do the same.
And again, Mon Health Medical Center Outpatient Lab, Mon Health Medical Park Building 2000, Monday through Friday, 8 a.m., 5 p.m., for your affordable walk-in testing.